Hello everyone, I hope you all are doing great. So guys, today we'll talk about aplastic anemia. What exactly is this condition? Its pathogenesis, causes, then clinical features, blood picture, bone marrow findings, and management, and lastly the treatment. I will also talk about the complication of bone marrow transplant, that's graft versus host disease. You must know about this topic while you are preparing for USMLE. So try to watch the entire video guys, and if my videos are helping you, do not hesitate to like, share and subscribe, because if you do that, that will boost me to make more videos. Okay, so let's discuss the topic in detail. Aplastic anemia is actually a disorder of unknown etiology. That means we do not know the cause in most of the time, and it's characterized by pancytopenia, that is anemia, leukopenia and thrombocytopenia resulting from aplasia of the bone marrow. Now what is aplasia? With the bone marrow is failing to develop the cells. Now in the pathogenesis, the bone marrow failure due to hematopoietic stem cell deficiency. What exactly is hematopoietic stem cell? These cells in the bone marrow, they divide to form myeloid stem cells and lymphoid stem cells. The myeloid stem cells, they give rise to platelets, RBC, WBC like neutrophils, eosinophil, basophil and monocytes, and the lymphoid stem cells, they give rise to lymphocytes. So I have made a video on hematopoiesis. So guys, I'll mention the link in the description box. If you haven't watched it, try to watch it, because if you watch that video, I'm sure you can answer most of the hematology questions. Okay, and also it is important to know that the marker of hematopoietic stem cell is CD34. Okay, now coming to the causes of aplastic anemia, mostly the cause is idiopathic. However, radiation can be a cause. Toxins like benzene and solvents, infections like parvovirus B19 and Epstein-Barr virus can be the cause. Drugs like chloramphenicol and sulfonamides. Now, Fanconi anemia, not to confuse with Fanconi syndrome, because Fanconi syndrome is a reabsorption defect in the renal tubules. Okay, but Fanconi anemia is an inherited DNA repair defect with the bone marrow failure. So when there's a bone marrow failure, there is a pancytopenia. They also have kephaloid spots. So what are the other conditions you see kephaloid spots, guys? Let me know in the comment section. Malformed thumb and the forearm, and these Fanconi anemia patients are prone for acute myeloid leukemia and tumors. Okay, tumors like the head and neck and the gastrointestinal tumors. Now coming to the clinical features, as they present with anemia, so they will have weakness and pallor, leukopenia, because the leukocytes prevents us from infections, because they have phagocytic actions, right? So they are prone for recurrent infections, thrombocytopenia, where there will be mucosal bleeding and petechiae. Okay, coming to the blood picture of aplastic anemia, I have made two pictures here to compare it from the normal. Normally you can see guys that that's enough number of RBC, WBC, and these are the platelets. You can see these are platelets and this is the RBC and the WBC. But in case of aplastic anemia, look at the number of all the cell line has been decreased, right? So that is decrease in RBC, then WBC and the platelet. Now it's also important to know that RBCs are normochromic and normocytic, and that is anisocytosis. Now what does anisocytosis means? That the red blood cells have varying sizes, okay, on the blood smear, and poikilocytosis means that the red blood cells are varying shape. Okay, so now coming to the bone marrow finding, when you do the bone marrow in aplastic anemia patients, it's a hypocellular marrow, because the cells in the marrow has been replaced with fat cells and also stromal cells. Okay, so the fat cells and stromal cells are increased and hematopoietic stem cells are decreased. Now when you do the bone marrow aspiration, you don't get any cells, okay, because they are all hypocellular, because they are all replaced by the fat and stromal cell. So when you do the aspiration, there'll be a dry tab. Okay, so aspiration from the bone marrow do not contain anything. Also guys, let me know in the comment section what are the other conditions you will see right there. Okay. Now coming to the management, eliminating the underlying cause. What were the underlying cause? Radiation. So eliminating those drugs were the cause, right? Toxins were the cause. So removing the underlying cause is important. Preventing infections. Now, as we saw that patients with aplastic anemia, they have leukopenia, right? So we know that the function of leukocytes is to prevent from infection. So it is always advised that patients with aplastic anemia, they should not visit hospital unless it is required. For example, let's say that they want to visit some family member who is admitted in the hospital, right? So it's better to avoid because they may get hospital acquired infections, all right? And then severe neutropenia. So if these patients have severe neutropenia, then only we give them broad spectrum antibiotics. Now how will you prevent hemorrhage? You prevent hemorrhage with platelet transfusion, and it's also important that there should be HLA matched. Okay, now coming to the last slide guys, the treatment, very important, bone marrow transplant. So that so what happens, the transplanted bone marrow, that will replace the failing marrow cells with the new ones, because the bone marrow is failing, they are not developing the cell. So the transplanted bone marrow will form the newer ones. Okay, and it is very important to know that the donor, it should be HLA matched, and if they are sibling, they are the best. Okay, and that's also important to know. And after bone marrow transplant, one of the disease they can get is called the graft versus host disease. Now what exactly is the graft versus host disease guys? So the WBC of the donor will recognize the recipient as foreign. Okay, and the WBC in the recipient will attack the body cells. All right, so that will lead to graft versus host disease. Okay, so that's important complication you should know. And other treatment which you can give in aplastic anemia is immunosuppressive therapy with anti-thymocyte globulin and cyclosporin A is best for patients which are not suitable for bone marrow transplant. That's also important to know. All right, and before a patient gets treatment, we know that these patients have leukopenia and they are prone for all kind of infection. So it is very important that if they have a low leukocyte count, you should put them in an isolated sterile room to reduce the risk of infection. Okay, so that was all about aplastic anemia guys. I hope this video has helped you, and if anyone wants to take tutor sessions for USMLE step 1 and step 2 CK, then try to attend the demo session, and if you like the demo session you can enroll for the course. Okay, and um, if there is any specific topic you want me to make video, let me know. Thank you so much.